Live now.
Good afternoon, Bucks County.
It's
Diane.
It's setting up. I just hit the button.
Good afternoon, Bucks County.
One more second.
Are we ready?
Waiting on Facebook.
It's live.
We're live.
Good afternoon, Bucks County. My name is Diane Marseglia. I am chair of the Bucks County Commissioners. I am going to be joined today by my colleagues as a fellow Commissioner Bob Harvey and Jean DiGirolamo, as well as our Director of Health, Dr. Damsker, and our Director of Emergency Management, Scott Forster. You are seeing us on a virtual press conference, the first one that we've done, so we're keeping our fingers crossed that this will work. We are doing this because we want to follow that order about stay at home and stay 6 feet apart. We tried staying 6 feet apart at our last press conference, but there are other people in the room, and so we think this is a better, safer way to go. The first thing I just wanted to tell you about today is how to tell if you're 6 feet apart, because I've been out lately and noticing that people are not doing that. So if you were to outstretch your arms, and I know you can't see me doing that right now, but if you did, from the tip of one middle finger to the tip of the other is approximately how tall you are. So I'm 5 feet tall. So if I stretch out my arms, I have to add another foot to know I'm 6 feet from somebody. So I encourage everybody to use that tool. I was at the pharmacy and the food store last night and saw families and couples there together. So I'm asking people to try not to do that as well, to go alone and stay 6 feet apart. And I want to share this story to show how much this can be done. My assistant, Anna, has cystic fibrosis. This is something she was born with. She's 33 now. In all those years, she has developed many friendships with people who have cystic fibrosis. But there is a rule in that community that you can never be closer than 6 feet. Some of you may have seen the movie 5 Feet Apart, but there's actually a book written by a Bucks County resident that goes with that movie. That's how Anna has maintained relationships with all those people for 33 years. Never a hug, always 6 feet apart. So I keep telling myself through this that if Anna has done it for 33 years, I can do it for a couple weeks, and I know you can too. So I know this is also difficult, so I'm asking for really unique ideas on what you're doing to cope with this and still stay a family or a couple, or how you're staying alone and staying healthy. So if you don't mind, I'd love it if you'd send me an email. My email is on the website, but it's dmarseglia@buckscounty.org. So thanks for listening to me virtually, and I'm going to pass this off to Commissioner Harvey. Hi, Bob.
Hi, Diane. Thank you. And I want to thank our staff for putting this together. This is the first of these, as Diane said. We do think this is a good example of modeling the kind of behavior we're hoping that people will exercise for the next couple of weeks. And we're hoping, obviously, it's only a couple of weeks. We did just this week launch through the Bucks County Redevelopment Authority a program to offer some zero interest loans to businesses in Bucks County. There are some restrictions about how that money can be used, but there is information available on our economic resources portal. So if you want to apply for some of those loans, take a look. The state and federal government, as we know, are passing a lot of laws regarding different kinds of policies and things that they're going to be doing, incentives and tax breaks and all kinds of things. We're still trying to digest everything that's coming out of Harrisburg and DC. We're looking to set up a hotline here at the county where businesses can call and get some direction about where to apply and how they can hopefully take advantage of those programs. So we're working very hard to get that set up. I do want to just give a number that I think is unsettling. I just heard this morning from our COO, which is that the unemployment numbers for Bucks County, just the most recent ones, indicated 200% increase in people filing for unemployment, 2,500 people. That's a 200% increase over the previous month. So that's obviously, we know that number was not just taken today. Those are numbers from several days ago. So we know that the pain is setting in for many people, and we're trying to do everything we can to help. One of the steps the commissioners have agreed to take, and we're working with, working with the Bucks County Association of Tax Collectors and also the Pennsylvania Association of Tax Collectors, Bucks County will be moving the penalties deadline for property taxes 30 days. Right now, the 10% penalty that you would pay if you did not have your taxes in, that penalty kicks in on July 1st. We are moving that to July 31st. It's possible it may be moved in the future, but hopefully we'll be able to come through this together. But we know that offering people an extra 30 days before they get hit with a 10% penalty on their property taxes, we think is the best way we can help. And with that, I'll turn over to Commissioner DiGirolamo.
Thank you, Bob, and good afternoon, everyone in Bucks County. Good to be with you today. You know, I was just thinking this morning, it's hard to believe that it was January 21st of this year when the first person with coronavirus was identified in the United States, back in the state of Washington. So it's literally been only 2 months that we've actually been dealing with this, although I think most people would think that it's been a lot longer than that. But the one thing I want to say is that I am really, really proud of the residents here in Bucks County, because I think for the most part, you have been all trying to do your very, very best when it comes to following the rules and the regulations that have been put in by the state and by the county, in making sure you stay home as much as possible. You limit your time outside of the home. You do all the social distancing, the important things like washing your hands. I think that we have really been doing a good job. Although this morning I did talk to a police officer from the lower part of the county who did tell me that some people are still not taking this seriously. So I would just like to implore you that while I think most people are doing a really, really good job, please limit the amount of time that you're spending outside of your home. Only leave, go to essential things that you need to go to, whether it's the supermarket or the pharmacy, or if you're required to go into work. And I think by all of us doing this and working together, that we will get over this virus as quickly as possible. And I would also like to give a shout out to our healthcare workers and our EMS and police officers for the outstanding job that they are doing, and I'm sure will continue to do, to protect the lives and the health and the welfare of the citizens here in Bucks County. So we all have to do our part to make sure that everybody is safe. And like Commissioner Marseglia shared a personal story with Anna, her assistant, I'd like to just share quickly a story about my mom, and I've talked about her before. She's 92 years old, have some underlying health conditions. She's still living at home, and we are doing everything we can as a family to make sure we limit the number of people that are allowed in the house to go out to see her. And of course, we're not allowing her to go anywhere as well. So we have to be very protective of our senior citizens. And again, I'd like to commend all the county employees and municipal employees who are working and trying to keep us safe. And with that, I would like to introduce our Director of Health here in Bucks County, who is doing a really phenomenal job, and that's Dr. Dave Damsker. Doctor?
Thank you very much, Commissioner. I appreciate that. I guess what's important is that we go over the number of cases that we've had recently and kind of go through a couple of points that I want to make, things that have changed over with symptoms. I think it's very important that we get it out there. So first of all, we have 144 cases here in Bucks County. We've had 16 new cases just today. And it's really important to note, we do have 10 people in the hospital, 6 of whom are serious but not critical. and we do have 4 people that are critical. And what's extremely important to note, though, is that of the 144 cases, most of the people that we talk to have family, friends, household contacts that are also sick with many of the same symptoms. And I want to make it very clear. So we have a lot more than 144 cases in Bucks County. 144 is just the number of people that have been confirmed and tested, but we have way more than that in Bucks County. So when people say, oh, the hospitalization rate of 10 people for every 144 cases, that number is, the real number is much lower than that. And knock on wood, it will continue to be lower than that. But what I can tell you is, though, for every case that we get, we have multiple people that also in their household or friends with very similar symptoms, or someone came home from New York City and infected them, but the person from New York never got tested. So we know that they were a case. So while this is very serious, and this does not diminish in any way, shape, or form how serious it can be, when you're looking at numbers from New York City and Italy and other areas like that, they are not doing testing of a lot of mildly symptomatic people. And I can speak to that firsthand here in Bucks County, and I'm assuming that what we're doing here is very similar to everywhere else. So hopefully that makes people feel a little bit better when you're seeing these numbers of hospitalized and the fatality rates, is that they are not testing a lot of people that are mildly ill. And we know that for a fact here in Bucks County already. Another thing I want to make very clear is that the first symptom that people get is not always going to be fever or respiratory symptoms. Sometimes the first symptoms people are getting are just overall fatigue, some body aches. And what's very striking now over the past several days is between 80 and 90% of all of our patients now have loss of smell and taste. It's sort of it's a metallic thing that they taste in their mouth. But this is becoming more and more common, partially because we're asking about it. I think it may have been there from the beginning, and I'm sure you've seen reports around the country. It is very, very important that anyone who's doing symptom screening at your business, or anyone who has a family member, if they are losing their taste and also have some of the other symptoms of coronavirus, you can basically say that they have coronavirus without even being tested. It's that important of a symptom that I really want to get it out there, that if you wake up in the morning, you have a runny nose and you just can't taste the food that you're eating, it's a very, very likely that you do have coronavirus based on all of our cases thus far. So I just want to get it out there to the public. It's sort of a new symptom over the last few days you may have heard about, but it is definitely true. And if it's true here in Bucks County, it's likely true everywhere else as well. So I wanted to just throw those a little bit of information out there for everyone to hear. Next, I guess Scott Forrester, Director of Emergency Management.
Thank you, David. Hello, everyone. We've been in this planning and preparedness for the coronavirus now for probably about 2.5 weeks, working with all of our community partners, our public safety agencies, and the hospitals and the like. I've got to commend them, as other folks have said. Our public safety agencies, our community partners, our healthcare workers have been working around the clock to try to prepare and respond to this situation. The Emergency Operations Center continues to support the municipalities and our public partners and our hospitals, and try to develop a common operating picture and a situation awareness for everybody and communicate good information. At this point, we continue to work at finding very scarce resources that are not available in large quantities, but we are finding them and we are sharing them with our providers and our responders. We work together as a team daily and communicate and share and assist each other as needed. We don't have more to say from the emergency response because it's the same stuff that we've been talking about regularly. But at this point, I'll open it up and turn it over to Larry for questions. Thank you.
Okay, this is Larry King, Public Information Director, and I've been getting questions from the media as this has been going on. And I think the first one is directed to Dr. Damsker from Nikki Ciaccio, who is with buckscountynewsfeed.com. And she said, we have heard from people whose doctors aren't prescribing tests and rather telling them to self-quarantine, though they do show symptoms. Is this for lack of tests available in the county?
Yeah, and that's a very interesting question. We've been saying this at many of our press conferences. I've said it before. If you're home and you're doing well and you have mild manageable symptoms, the doctors are correct that whether you have coronavirus or not, because we're all being quarantined in our homes anyway, there's no reason to rush out and get tested to confirm whether you have it or not. In some situations. Now, there may be situations where someone works at a healthcare site or as a first responder. So there are times where it's important for people to get tested. But if you're just going to be hanging out at your house for the next 10 days anyway, you have mild symptoms, you're not short of breath, anything like that, getting you tested at some of our sites would possibly, especially of our hospitals, would take away potentially some of the staff that need to take care of our very ill people. So there is a little bit of a lack of testing go around. There's no question about it. No one has unlimited testing at this point. But we do continue to give that advice that if you're home and you're not very sick and you don't have a job that requires you to go in, we are recommending that those people stay home and medicate themselves. You can take Tylenol, you can take ibuprofen, you can get hydrated, you can sleep a lot. The common sense things that doctors always talk about. But that is true that there's no reason to go out and rush and get tested if you have mild symptoms.
Okay, the next questions come from Tom Sofield of Levittown Now. He's asking for Scott, how does the county stand on its medical supplies at this point? How has the supply distribution gone? And if you can say, this is probably for Dr. Damsker, how many medical and first responders in the county have COVID-19?
I'll take that one first. The supply chain, as you know, is, and I've spoken about before, there are certain supplies that are very difficult to acquire. We have been able to get some from purchasing and from the Strategic National Stockpile at the Commonwealth. There have been deliveries to hospitals, to long-term care facilities, and to emergency responders. But they're based on the size. They're not enough for every single person that is in that healthcare agency or in that public safety agency. But we have gotten some supplies out and we continue to work on getting additional supplies. We are waiting for a shipment to come. It was planned to come the middle of this week, but the arrival continues to be pushed back. And I'm hoping at some point next week, we're going to receive a large supply of needed materials. But the same thing that's happening to us is happening to other counties and the Commonwealth. So when there's lack of supplies available, it's very difficult to know when you're going to get them and how many you're going to get of that shipment.
And just to speak about the first responders, we do have, obviously, we have one well-publicized case of an officer in Middletown Township who is recovering very well. And there's also there's a second case of a first responder. I'm not going to say where that first responder is located, but they also are doing very well at this point.
Okay. I think this is a follow-up on the supplies for Scott. This is from Anna Orso of the Philadelphia Inquirer. She asked, several counties in our area have asked for donations, and the city of Philadelphia this week asked for approval to spend millions on procuring its own N95 masks. Does Bucks County itself need masks? And if so, has the county identified how many they need, what that will cost, and where they will get them from? And finally, have you identified where they will be used?
Well, the county does know a rough amount of the needed supplies because we do receive resource requests from healthcare facilities and from emergency responders. So we have an idea of how many that we need, but as time goes, that number is going to grow because as the burn rate occurs and as people use these supplies, they're going to need additional ones. We are hoping that the supply chain opens up a little bit and supplies become available for purchase and that are going to be provided to us by the federal government through the state. At this point, we don't know the exact number, how many we're going to need, but we have reached out to the business community that if they had any personal protective equipment on hand that they wanted to share or donate, that they could do that. We'd like new equipment, new personal protective equipment, because we have to ensure that it meets certain standards. It's going to protect the responders or healthcare workers, and it's in adequate shape and condition. So those are things that we have looked at, and if people or businesses out there have supplies they want to donate that they have on hand, we would be happy to accept them and look at them and then distribute them to the people who are needed, who need them. And we've also received them. We've received some supplies from businesses already who has donated them.
And Larry, if I can jump on there too. Another thing we did was we reached out through the Chambers of Commerce and the different economic agencies here in Bucks to have them put out calls to all the companies they have partnerships with and relationships with, that maybe they don't necessarily make N95 masks, but they might be in some kind of textile field. Maybe they don't make the face shields, but they might be in the plastics field industry. And we have sent out some technical specifications. We've gotten some good feedback from some of those companies who are willing to see if they can retool and help. We've connected them to the emergency management agency, and some of them have been passed on to the state so that they can, give some direction in terms of what's needed and how they might go about manufacturing something that can be helpful.
Okay, this next question is from Katie Meyer of WHYY and Spotlight, PA. She was wondering if anybody can tell us whether there's evidence that anyone who voted in the special election last week in Bensalem got sick with COVID-19.
I can tell you that none of our cases have specifically mentioned that as an exposure as of now. That doesn't mean it didn't happen, but we don't have any evidence that it did occur at this time.
Okay. Next question is from Regina Young from the Bucks County Herald. I believe this might be a question for the commissioners. From what I've seen on social media, there still seems to be a bit of confusion regarding county parks, even though according to the county website, all county parks and trails are closed. Can someone reiterate the policy at this time for the public and discuss the measures taken at Peace Valley Park to restrict access?
I'm happy to go first, and then Bob and Jean can chime in. First of all, there is sometimes some confusion between the state parks and the county parks. Initially, the state closed all their parks. It seems they may have opened some of them. Our parks are closed. We are following the governor's order. We are also protecting our staff who would be in those parks. So they are not open. Our trails are open. So if you can get to a trail that doesn't have access through a park, you're welcome to do that. Bob or Jean, anything?
Okay. Next question is from Alex Gross of DelawareValleyNews.com. And he asks, if someone is sick, has COVID-19 and recovers, is it possible to get it again?
The answer to that right now is it is not believed to be the case. So as of now, we are going along with the current science that you cannot be reinfected for this current strain. I don't think anybody knows what's going to happen in the future. If, for instance, next year there's a slight tweak to the virus and it circulates again, we're not sure if it's going to be like the flu. But the current science indicates, though, that once you are infected, you develop antibodies and you are immune to the strain that's currently circulating.
Okay, and another medical question from Chris Ullery of The Intelligencer. And he asks, with people now coming out of isolation, is the county able to set some kind of benchmark over the next 2 weeks to determine if the social distancing is working?
What we're looking at in general is for the new cases that are starting to pop up. We are looking at every new case at their incubation period, when they were likely exposed. And we soon, probably if not this weekend or early next week, we should not be seeing anyone becoming sick that either isn't an essential worker, like a healthcare provider that has to be out. But we should not be seeing community spread if everyone is staying in their home. So for social distancing to work, obviously we can't stop people that have to go to work from getting it. We can't stop people if someone has a son from New York City who's sick and comes to their house, which we're seeing some of. We can't stop all those kinds of transmission, but we shouldn't be seeing a whole lot of cases where we can't identify the source. And those numbers over the last couple of days do seem to have dropped, but we won't know more until probably, in about 4 or 5 days from now. We'll be able to look at every single day's cases, and we do expect to see a dropping of the community spread where we have no idea where they got it from, assuming they're not, again, essential workers.
Okay. Another question for you, Doc. Tom Sofield again from Levittown Now is asking, how long are test results taking and whether there's a delay? We've heard of people waiting anywhere from 24 hours to 5 days in Lower Bucks.
Yeah, and those numbers are pretty accurate. I would say even the tests that we approve here at the health department for certain cases, those test results are taking 48 hours now. They used to be quicker. I think every lab is backed up to a degree, but we are seeing most results are coming back between 2 and 5 days. And that's an accurate representation at this time, yes.
Okay, and again from Alex Gross, he's wondering if there have been reports of price gouging in Bucks County related to COVID-19.
We did. We mentioned on Wednesday, I think our last press conference, or it was Tuesday, that we did have a couple of cases that were being investigated that we were aware of, the commissioners were aware of. There was one incident I know in Lower Bucks County of accusation of price gouging that popped up on social media. It was investigated and found not to be an accurate accusation. The business was not price gouging, but there was another claim of price gouging for a business that was doing it. And so there have been some, but so far it seems as if most business owners are doing the right thing.
Okay, and the last question that I have on my list comes from Kara Seymour at Patch, but I believe Dr. Damsker already covered it, but if there's anything else to add, she was asking that she's hearing questions and was wondering if you believe that today's slight decrease in reported cases is evidence that the social distancing measures are working. I think you covered that, but if we missed anything, I'll throw it back to you, Doc.
Yeah, again, we have 16 cases today thus far. And remember, when we talk about cases, they can kind of come at us any time of day or night. So, we did have 18 yesterday, which was a decrease. We have the 16 today. We may get a few more. But I'm more looking at not the numbers so much, but the types of cases that we're getting. Again, as I mentioned a minute ago, it's the incubation date, the actual date of onset of symptoms is very important, as well as how they got it. And that's what we're focused on, whether we get 16 cases or 22 cases. That's not really the issue as much as the source of the case.
Okay, thank you. Having received no more questions from the media, I'm going to throw this back to Commissioner Marseglia to close this out.
Thank you. And I just want to thank everybody for bearing with us as we try to do the right thing and stay virtual and stay 6 feet apart. I am really proud of all the first responders in Bucks County, the residents of Bucks County, my colleagues. We're doing all the best we can. Bucks County was like the birthplace of this nation. And so we are going to stay strong like that and continue to lead this nation by staying safe, stay home, and stay 6 feet apart. Thanks.